UK Prime Minister Boris Johnson has revealed plans to lift some of the major COVID-19 restrictions, including face masks and social distancing measures from the 19th of July. He stressed upon the importance of personal responsibility over government-imposed curbs. Listen in.
We will allow all businesses to reopen, including nightclubs. We will lift the limit on named visitors to care homes and on numbers of people attending concerts, theatre and sports events. We will end the 1 metre plus rule on social distancing and the legal obligation to wear a face covering, although guidance will suggest where you might choose to do so, especially when cases are rising and where you come into contact with people you don't normally meet in enclosed spaces, such as obviously crowded public transport.
So here are some of the major changes announced by the UK government. Face mask and social distancing rules will be scrapped in 2 weeks' time. People will not be required to wear a face mask by law. The government aims to transition to a system where people would be allowed to make decisions. Legal limits on indoor and outdoor gatherings will be lifted on the 4th of September. Businesses, including nightclubs, will be allowed to operate. People can now start working from office. These announcements come with a warning that the country might witness more than 50,000 COVID-19 cases a day by the 19th of July.
There could be 50,000 cases detected per day by the 19th. And again, as we predicted, we're seeing rising hospital admissions. And we must reconcile ourselves, sadly, to more deaths from COVID.
45 million people in the UK have been partially vaccinated. 33 million are fully vaccinated. The UK government has reduced the interval between the 2 doses from 12 weeks to 8 weeks for those under 40 years of age. This is aimed at helping speed up the vaccination drive and also making sure that everyone above 18 years of age gets their jabs as soon as possible. Prime Minister Johnson had initially planned to fully reopen the country on the 21st of June. However, he was forced to push the date amid rising cases of the highly contagious Delta variant. This variant now accounts for nearly all COVID-19 cases in Britain. The government's emphasis on personal judgment has concerned the health experts. They say that allowing people to make their own choices means handing over control to some of the least caring members of the society. UK's opposition party thinks that Prime Minister Johnson is moving too fast with the reopening plans. The Labour Party leader, Keir Starmer, has called the plan reckless.
We all want the restrictions to be lifted, and we are going to have to find a way of living with the virus. But that can't just be a soundbite. We need a proper plan, and to throw off all protections at the same time when the infection rate is still going up is reckless.
The London Mayor Sadiq Khan has said that further discussions are planned over mask wearing, especially on public transport. Meanwhile, the UK government is also expected to allow fully vaccinated Britons to travel to most countries in Europe without the 10-day quarantine. However, European countries have shown no signs of relaxing their rules to allow travellers from Britain. For more on these developments, our London Bureau Chief Mandy Clark joining us. Hi, Mandy. The opposition has called this plan reckless. Explain to our viewers the risks that come with this announcement of reopening.
Well, I think overwhelmingly some of the population are a bit baffled with the timing of the lifting of all the restrictions due to take place on July 19th, because before that, Boris Johnson always said he'd be led by the data, and that's why we saw that delay in June. But all of a sudden, no face mask wearing in public, that will be up to each person's discretion. It seems to that all the rules has been thrown out at a time when we are seeing those rapid increase in cases. Even Sajid Javid, the new health secretary, said it could rise up to 100,000 cases over summer. But he went on to say that there is a lot of other things happening besides COVID. Many patients have ignored more serious problems because the health department has been overwhelmed, that we can't just focus on COVID. But it does seem very strange timing, especially as that number is rising rapidly.
It does seem strange considering the fact that earlier on, when the restrictions were very much in place and the government was looking at even imposing fines and penalties to ensure that the people are following the rules, and those measures, the strict penalties were in place, a lot of people were not following the norms. And now leaving the decision of safeguarding themselves to the people and not to the government does seem like a risky proposition.
It seems a real step change. The question is this the new health minister? Of course, Matt Hancock had to step down just a few weeks ago. Sada Javid has stepped into the fore. Is this really the leadership of the new health secretary, or is it that they feel that COVID has gone on too long and they have to reboost that British economy? Now, just today, the German chancellor has said that there will be no restrictions for British coming in, which is a change. But this lack of travel restrictions is also a concern because the Delta variant is so dominant and spreading in Britain. There is a chance that, of course, that with lifting of restrictions and travel restrictions for British travellers, that spread can happen a lot more quickly. So it is strange timings, but we'll have to wait and see if their play works and they're able to lift those restrictions and not see the COVID variant spread as rapidly as it has done, though the science certainly hasn't proved that to be the case yet.
Mandy Clark, leaving it there for the moment. Thanks very much for those updates. WION now available in your country. Download the app now. Get all the news on the move.